Bernard? Bernard, are you alright? Can I have some help, please?
What's going on?
Can you put out a 2222 call and ask for the adult resuscitation team and bring back the resuscitation trolley?
The prevention of patient deterioration is a challenge in all healthcare systems. Hospitals are faced with an ageing population with increasing comorbidities along with chronic staff shortages. When there is a failure to detect a deteriorating patient at an early stage, opportunities for early intervention are missed, which can lead to a higher complexity of care being required along with an increased cost. The point of care has traditionally been poorly served by e-health architecture, such as an electronic health record and even Wi-Fi. Early warning score systems have been widely used internationally to facilitate the early detection of a patient's deterioration by classifying a patient's severity of illness to the presentation of a score, which is calculated based on a number of clinical observations or vital signs. In Ireland, multiple high-profile reports into quality of patient care and patient safety called for the introduction of a national early warning score system. These included the Mallow Hospital Report, the Tala Hospital Report, as well as the Civita Halapanava Report, which highlighted the failure of staff to recognise and to respond to signs of clinical deterioration. In 2013, Ireland became the first country to begin the rollout of a National Early Warning Score, or INEWS for short. In the current system, a nurse records the patient's observations such as heart rate and blood pressure and transcribes them onto a paper-based observation record. This observation record is colour-coded and numbered. If a patient's vital sign is normal, it scores a 0, and if it is abnormal, it will score from 1 to 3 based on the degree of abnormality. The total INEWS score is then calculated based on the combination of all individual vital sign scores, and this score determines the response required to the patient. For example, a patient scoring a 3 would require 4 hourly observations and the medical team to review within 1 hour. Unfortunately, despite our progressive new system, an audit carried out in 2017 in 9 acute hospitals showed poor compliance with the INEWS clinical standard. Shockingly, only 55% of the scores are correctly calculated, and in one hospital no score was correctly calculated in the charts audited. This is a frightening statistic given that the subsequent care received by a patient is based on an accurate INEWS calculation. In September 2020, the INEWS version 2 guideline was published, one of its key recommendations being the move towards a digital INEWS system to enhance patient safety. The most popular digital INEWS solution that is being used in Ireland is Synchrify's Q300. This is a tablet-based application that is attached to and compatible with the existing vital signs machine. Parameters such as blood pressure and oxygen saturation are automatically transferred into the system, eliminating transcription error while the INEWS is automatically calculated. The response required is highlighted on the screen for the nursing staff. The system also highlights when repeat observations are due, reducing the risk of missed observations and unrecognised deterioration. The aim of our project was to progress the national rollout of a digital INEWS system. First, we examined the relevant literature. In 2015, HICWA published a health technology assessment into the use of information technology in early warning systems. It concluded that, in addition to potential gains in patient safety, it can also result in a substantial efficiency gain in terms of utilisation of acute hospital beds. They estimate significant reductions in general and ICU length of stay based on the available evidence. The above figures translate to a national hospital capacity gain of over 800,000 bed days per annum and over 30,000 ICU bed days per annum. These figures are staggering given our well-documented lack of bed capacity. We also identified some further studies again showing decreases in ICU admissions, cardiac arrests, mortality and length of stay following the introduction of a digital INEWS system. We then engaged with a variety of stakeholders to inform the direction of our project. The main sites we engaged with were Galway Clinic, who were the first hospital to complete a hospital-wide rollout of Synchrify's Q300 system, and Cavan General Hospital, who are currently a national demonstrator site for digital INEWS. They have rolled out Q300 on one ward and are now progressing towards a hospital-wide rollout. The sites provided us with staff feedback which was extremely positive. Themes that emerged included increased staff productivity, improved accuracy, improved patient care, and the staff felt that the system allowed for more patient-centred care. They also provided us with audit data showing substantial decreases in errors in the accuracy of recording vital signs and calculating of news following the introduction of the digital system. As a result of our engagement, we identified several areas of work that needed to be completed in order to successfully roll out a national digital news system. Patient engagement highlighted concern over the use and storage of data, as well as the lack of patient feedback collected at implementation sites. Clinical staff highlighted that with an increasing accuracy, more alerts may be generated for patient reviews, and this may overwhelm already overstretched medical teams in acute hospitals. They also noted that there was no studies from an Irish setting showing the benefit of a digital system on clinical outcomes. Local management teams suggested the development of a toolkit to share learning from rollout sites to assist new sites. And nationally, it was agreed that the development of a business case would be the most useful method for us to progress rollout. Following our engagement, our deliverables became a national business case for rollout, a clinical evaluation study protocol, a data protection impact assessment, and pre- and post-implementation site checklists. We costed and proposed a timeline for implementing Q300. Unfortunately, we are unable to share the pricing as it is commercially sensitive. We also developed a suggested leadership and governance structure. We produced a DPIA to ensure compliance with relevant standards, as well as to ensure that patients are not at risk of their data protection rights being violated. A comprehensive clinical evaluation protocol was developed to be run in conjunction with Cavan's rollout. This will show the impact of the digital system on preventing patient deterioration in an Irish setting. It will also study whether there is a significant change in the number of alerts with a digital system and whether the resources in place can cope with an increase in alerts. This will inform the optimal response model during national rollout. Our pre-implementation site checklist will allow potential sites to assess their readiness for rollout of a digital news system by assessing areas such as house machine compatibility as well as Wi-Fi assessment. Our post-implementation site checklist allows sites to assess the effectiveness of their rollout through staff and patient feedback as well as clinical audit. The next steps are to prove the clinical effectiveness in Cavan as well as assess the number of alerts generated. The effectiveness of digital news is also due to be assessed in Tala, and this will be followed as to its effectiveness in a Model 4 hospital. Finally, based on the lessons learned at these trial sites, the national business case can be submitted with the subsequent national rollout of a digital news system. Looking to the future, the digital news can be integrated with a national EHR or laboratory information system. The integration of such data could support the development of clinical decision support systems, as well as the use of predictive data analytics to predict patients at risk of clinical deterioration, allowing clinicians to intervene at an even earlier stage. On behalf of the team, I would like to thank Annette for supervising our project and to all the stakeholders who gave us so much time and help with the project. And congratulations to everyone on completing their projects here today.